Around the world with MS World, I'm Dr. Daniel Kantor, here joined by Brian Weinshenker, who is professor of neurology at Mayo Clinic. You're standing in front of a poster that you have about a sign for multiple sclerosis, McArdle Sign. Can you tell me more about that?
Yeah, McArdle Sign is a increase in weakness with neck flexion.
Okay.
And yep, typically we test patients by asking them to extend their neck, clinically measuring their finger extensor strength, and then we ask them to flex their neck. And just about every MS patient will get weaker, and that difference between strength and extension and flexion is McArdle Sign. We rate it from 0 to 3. And what we show in this study is this is present in the majority of patients with MS who have some degree of finger extensor weakness, even if trivial. And we, to just confirm this, built a device that quantitates strength using a torque cell. And indeed, we were able to quantitate this. We did a blinded study of about 125 patients. That includes patients with MS, patients with other myelopathy, patients who had peripheral nerve lesions with finger extensor weakness, and healthy controls. And this sign is seen only in MS patients. So if you take a 10% decrease in strength with neck flexion, that's present in about 70% of the MS patients, none of the controls. So in a sense, sort of a new sign described in only one paper in the literature from the 1980s, attributed to M.J. McArdle, but thought at that time to be a very rare thing, seen only in patients with very advanced MS. But what we show here is this sign is present in the majority of patients with MS and is entirely specific, and I think can help clinicians in their practice when they see patients with unusual myelopathies and they're not sure if it's MS or not. Detecting this sign, I think, is a strong clue that MS is the diagnosis.
So let's talk about that word. So myelopathy comes from the Greek word myelos. And so myelos is marrow, and the ancient Greeks thought that what we know as the spinal cord was the bone marrow of the spinal column. Good thing they didn't do bone marrow biopsies. And pathy, like pathological. So if somebody has spinal cord dysfunction, it's called a myelopathy. My question is, many people at home know about this electric shock feeling, and they know that we call it Lhermitte's phenomenon. How is that related to this?
Well, that's a good question. We think it's a similar phenomena, except that, number one, this is motor instead of sensory. This one is a negative finding, whereas Lhermitte's is a positive finding. And this is more common. Lhermitte's, of course, is fairly common, but it's usually transient. Most people, it resolves. Once you have this finding, it seems to persist. And although it's essentially unrecognized, only one paper in the literature, it's amazingly common.
Well, your name is synonymous for a lot of people with this idea of something called neuromyelitis optica, de Vick's disease, or NMO. What would happen if somebody with NMO presented? Would they have the McArdle sign?
We tested patients with NMO. I believe 4. None of them had it.
Why do you think that is?
Well, that's a good question. I think just the pathologic substrate of NMO is different than it is in MS. There are not large numbers of viable axons with prominent demyelination. There's more axonal injury. Might relate to the similar phenomena of why progressive MS or progressive disease does not occur in NMO patients. Just a different pathologic substrate. Of course, that's speculation, but that's my best guess.
So it could be that they're actually already damaged, those nerves in NMO, and so just doing an extension and an flexion isn't going to bring out like you could bring out.
It is, as you say, stretched-induced conduction block.
Well, I want to thank you so much for joining us, and I want to thank all of you back home.